afternoon, and welcome to an informal conversation between Michael Linver, retired radiologist from Albuquerque, New Mexico, and Harvey Buchalter, retired teacher from Albuquerque Public Schools and Los Lunas Public Schools, to have a talk about Mike's experience of having been a physician with the Indian Health Service here in New Mexico. I'm Linda Goff, and I'm the president of the New Mexico Jewish Historical Society. And we received a grant from the New Mexico Humanities Council CARES Act to interview New Mexico physicians who served with the Indian Health Service between the years of 1960 and 1980. This is the second of two conversations that we are recording. The first was the other day between Dr. Larry Chandler in Santa Fe, New Mexico, and Dr. Noel Pugash, retired history professor from UNM. The actual written transcripts of the interviews are available at this time on our website at www.NMJHS. So I want to thank you, Mike, for joining us today and having this conversation about your experiences. And Harvey, I will let you take it away from here.
This is a great pleasure to interview my old friend, old compadre, Nuevo Mexico, from all sorts of connections that we have.
Yeah.
Right, and goes back a long, long time.
40 years.
And yeah, it's about 40 years. We were both very young.
Still are.
Well, we still are. So that's great. It really is a great pleasure to be talking with you again, my friend. Even though it's through this technological thing called Zoom, I'm not a big fan, as you can tell. That's okay. We'll figure out how we can get together soon in person. Okay, so let's get started. My first question, not really a question, is please fill in the blanks about your life, specifically where you grew up and your education.
I grew up in Toledo, Ohio. My dad actually was born in Detroit, and so we were Midwesterners. His parents came from Eastern Europe. They grew up 20 miles apart from each other, one in Poland and one in the Ukraine. But of course, in those days, nobody crossed the border, and they didn't meet until they came to the United States. And then my grandfather settled in Detroit and moved to Toledo right after my father was born. And so I was raised in Toledo and spent my formative years there until I was 18. And then I went away to the University of Michigan, all the way up 40 miles up the road in Ann Arbor, and was fortunate enough to meet my wife-to-be, Minna Jo, there. And from there, I finished my undergraduate training and went to University of Pittsburgh for medical school. And in medical school, I met this wonderful guy who was the chief of epidemiology. And he had a program that where he sent students, medical students, every year out to the Big Navajo. And so we had this connection to the Navajo reservation that I knew about. So I continued on with my training. I did my internship at the San Francisco General Hospital in San Francisco at the University of California. And then was at an impasse. I wasn't sure what to do with my career. I was interested in internal medicine, maybe, obstetrics, maybe, radiology, maybe. So I looked around at my options at that time, and I remembered my link to the Indian Health Service. And it turned out that there was a large contingent of University of Pittsburgh graduates on the Big Navajo because of their experience through this Department of Epidemiology at the University of Pittsburgh. So I called some of them. I said, "What's it like out there?" And they said, "It's a fantastic experience. You ought to try to get a position." So I did apply, and I was accepted to the PHS Indian Hospital in Albuquerque. So I hadn't completed any of my specialty training yet. After my experience in the Indian Health Service for 2 years, I was a general medical officer, I went back and did a residency in radiology, and then pursued a career in radiology in Albuquerque in private practice with X-ray Associates for 37 years, and took my specialty in breast imaging, which became my my true passion and my specialty for the next for all of that time. In any event, getting back to the Indian Health Service, I had 2 wonderful years in Albuquerque working at the Indian Hospital, and that's really where I think we're at as far as this discussion goes, Harvey.
Great. When did you decide you were going to be a doctor?
I was about 7, and I was indoctrinated early on, no pun intended, by my dad, who was in the scrap business, and he had such solace all the time between his employees and equipment breaking down. He worked so hard and was always hassled, and I didn't see him very often until about 8 o'clock at night. He worked so hard, and he would say to me, you know, you really ought to consider a profession, because I want you to be able to take your inventory between your ears wherever you go. You don't have to have the schlepping and the problems that I've had. You really ought to consider a career in medicine. And as it happened, my uncle, my grandfather's brothers, he brought over to Toledo one at a time. My grandfather was the oldest, and there were 3 other brothers in Toledo. One of them was my Uncle Mike, who was the youngest. In fact, in Europe, they had kids for 30 years. My Uncle Mike was younger than my father, and yet he was my father's uncle. He was the youngest, and he was a physician. He was trained in Germany. He escaped during the pre-World War II years to Russia, of all places, where he joined the Russian army and fought in World War II, and then was in a displaced persons camp after the war. And my grandfather found him somehow, brought him to Toledo. So he was my role model as far as a physician. And my Aunt Bella would tell, who was even more adamant, she said, "You've got to become a doctor." And so that was my emphasis. I remember I found an old project I put together when I was 10, all about becoming a doctor. So it was early on due to my family connections.
Could you tell us a little bit about specifically about Jewish life of your family, the Jewish life of your family?
Well, my parents were both observant, but only moderately so. My father more than my mom. My mom was not raised in a very observant household. My grandparents, of course, were traditional. They were Orthodox. And I remember going to the Orthodox shul when I was really little with my grandfather for years and years. When I finally got to middle school age, we joined a conservative congregation, ironically called B'nai Israel, in Toledo. And that's where I became a bar mitzvah. I continued on. I was confirmed there as well. And those years were important to me because I really did connect with my Jewish roots. My grandfather, of course, was an ardent Zionist. And in fact, he was so much so that he became involved with all the Zionist organizations. He would have meetings at his home. I met lots of famous people. When my grandfather was younger, he met Golda Meir. He had Golda Meir at his home, Abba Eban. And I met Moshe Dayan through my grandfather when they came to Toledo to raise money for the UJA. And so I was a very strong Zionist and moderately observant. I wouldn't say I was a traditional in the real sense that my grandfather was, but again, it was important. My Jewishness was always very important, very important.
Your Jewishness is also linked to your love of music.
It is. Early on, I've always loved to sing, and I had an opportunity when I was in Tucson. Before we moved back to Albuquerque in 1980, after I left Indian Health Service, I did all my training in various places, and I took a job in Tucson where we joined the conservative congregation, but there was also a group of ex-Toledoans, ironically, who had started a splinter congregation that was somewhere between conservative and reform. And there were about 120 families, and we met at the JCC. We had a little portable ark there, and we met twice a month. But they didn't have a closet, they didn't have a cantor. So they asked me to be the cantor because they saw that I loved to sing and I had a good voice, relatively good, not like my daughter, but not too bad. And so I started to learn the liturgy more completely, and I really became enamored with Jewish music at that point. And I met some wonderful people there who we formed a little group called Sabbation, which is the river that you had to cross. I don't remember, somewhere in the Bible. And we sang as a trio. Janice Ehrman, the woman who sang with me, was the cantor at the Reform Temple in Tucson. And Paul Bartlett, the other fellow, was a brilliant musician who played the guitar, he played the oud. He spoke fluent Arabic as well as English, well, he spoke English too, as well as Hebrew. So we started singing together, and I brought that tradition to Albuquerque when I came, and I was fortunate enough 2 weeks after we moved here to meet Diane Chadro. And so Diane and I struck up a friendship, and it happened that the next weekend was Mother's Day, and they had asked Judy Garden-Schwartz to sing at the Mother's Day dinner luncheon, but Judy got sick. So at the last minute, they called Diane and to fill in, and Diane called me and she said, "Can we just do something?" So in one evening, we put together a show of songs, and it went really well the next day at the Mother's Day luncheon. And Diane and I formed this wonderful, not only personal friendship, but a musical friendship, which has lasted to this day. And we took on teaching the junior choir, the two of us, at the synagogue together for 12 years after that, which was a wonderful experience.
Again, that's one of the other things that we miss, is your presence with that at the show. You already answered how you, oh yeah, can you tell us what years you served with the Indian Health Service?
Yes, 1971. I began in 71, was there until 1973, when I received a honorable discharge.
Right, okay. Now for the big question. You can add information about this later on too, as things occur to you after you've already answered, but what specific memories do you have about your service with the Indian Health Service? For example, the camaraderie you might have had with other Jewish doctors. I know there are lots of Jewish doctors in the Indian Health, something we've learned just by doing this research. And what memories do you have that come to mind immediately?
Well, I'll tell you, they're very fond memories.
You can add to that later on too.
Okay.
Yeah.
My memories are all overall very good. It was a tremendous opportunity to learn about a new culture that I did not understand before. And I had to practice medicine in a totally different way than I ever had been taught as a medical student and an intern. Because we are dealing with a population that does not relate their personal feelings openly. And so we had to find new ways to find out what their problems were. So that was always a challenge. The Navajo are very, very quiet. They don't, in fact, I was told that they don't even allow their kids to speak openly until they're about 5. I don't know if that's really true, but they don't speak openly about their feeling very often. It's just a traditional, a cultural phenomenon. And so it was a challenge at first to try to get a good history from the patients. And our hospital was unique because we were designated as one of the, I think the only hospital that specialized in treating patients with tuberculosis in the Indian Health Service. So any patient who needed to be hospitalized for tuberculosis of Native American roots was brought to Albuquerque. So it was mainly Navajo. I would say 80 to 90% of our patients were Navajo. But we also had several Pueblo patients, of course, from several of the Pueblos. And we had patients from as far away as Yakima in Washington and from South Dakota, from the Rosebud. We had patients from Utah, the Utes, but they're mostly Navajo. But it was a phenomenal experience to learn about all these different cultures And the people were generally very nice. The patients were very nice. We had to learn some new skills though, because I can tell you, especially the more traditional Navajo, and most of them were pretty traditional, the ones we saw, because they were mostly older. Those are the ones that tended to get tuberculosis or when it would manifest itself as a serious disease. And they were more traditional. And as a result, we had to find ways to treat them that were acceptable to them. And one of the real challenges was when they started to feel better from their treatment with us, they wanted to go home for a Yebishe, for a sing, which was the curative, the true curative procedure. They considered us just kind of the ones who were helping out, but it was the medicine men who really had the power. And so they wanted to go home for a Yebishe, for a sing that was going to be the final curative procedure. So we had to develop a rapport with the medicine men out on the reservation to make sure that after the patients went out for their Yebishe, they would come back for the rest of their treatment. And it was a challenge. But I can tell you, most of the time, it worked out really well. We were fortunate in a way that two of my patients were very prominent medicine men, George Blue Eyes and Sam Yazzie. I don't know if you remember Laura Gilpin. She was this wonderful photographer who produced the most spectacular book of photographs from of the Navajo between 1920 and 1950. And her book, During Navajo, has this color picture right in the middle of the book of Sam Yazzie when he was like 75. When I saw him, he was 90. He still looked exactly the same, 6 feet tall, straight as an arrow, strong-willed and a strong person. And he had tuberculosis, so we were treating him. And luckily, we were able to establish a rapport with Sam and with George Blue Eyes, who did have blue eyes, incidentally. He must have had some Anglo blood in him too. They both agreed to help us establish a rapport with the medicine men so that we could get the patients to come back after their Yebishe. So we allowed the patients to go home and they were getting better. They usually got 6 weeks of what we call triple therapy, which was 3 different drugs. That's the only way you could treat TB to really make it, to get rid of it, because you tended to develop drug resistance if you treated it only with 1 or 2 drugs. And unfortunately, the third drug was one you had to give intramuscularly, streptomycin. So that's why we had to keep the patients in the hospital for 6 weeks before they could be allowed to go home. They got 2 years of treatment, but the rest could be done as outpatients. So we had to keep them in the hospital for 6 weeks. And that's why it was so critical to have this relationship with the medicine men so that they would be able to come back, because we wanted the patients to be comfortable within their own culture as well as ours. And the patients were very appreciative that we did allow them to go home. We had some problems who were problematic, of course. We had some who were problems with alcohol where they wouldn't come back, but most of them did come back. Most of them did come back, and we're very grateful for the treatment they got. It was quite an experience.
Did you find yourself drawing on your Jewish background during that time?
Well, in the sense that, yes, I mean, the universality of Judaism, the fact that we reach out to all people and consider all human life important. To me, that was, well, obviously it's one of the precepts of medicine too, but it spilled over from my Judaism and my respect for life and for all people. And I think that kind of rapport allowed me to connect with the patients really, really well. And the fact that I can tell you, 10 of my fellow physicians with whom I worked on a regular basis were Jewish. Art Kaufman, whom you know over at UNM, being preeminent among them, a fellow named Jack Noble, and 2 of our consulting doctors who came over every single week. We used to have what they called a chest conference because most of the patients had pulmonary TB. We had some with renal TB, and we saw TB of the spine. It's called Pott's disease, a bunch of others, but mostly it was pulmonary TB. And so we had a chest conference every week, and there was this wonderful older internist named Bernie Lowenstein, who was just fantastic. He would come over. He was from Brooklyn. He had that wonderful Brooklyn accent, but a wonderful guy. And the radiologist who ran the conference was this fantastic radiologist. He was the one who convinced me to go into radiology because he was became my role model. A guy named Matt Lesser. And Matt was was with the Presbyterian group, but he took of his own volition every single week, came over and led the chest conference, showed us the x-rays. And so I established a rapport because they were both Jewish. We had a Jewish connection. Matt later became quite religious. I found out, changed his name to Matt Ben Lesser, and a wonderful guy. So I had an opportunity to share my Jewish roots and experience with many of my colleagues because of the Jewish connection. We had all around the reservation. I had a good friend who was actually with me in San Francisco, as he was my resident when I was an intern there, a guy named Arnie Schatz, and he was in Shiprock. So he used to come to Albuquerque to shop anyway, so they'd stay with us. So he became a good friend, and a fellow known in Magdalena named Joel Weissman. Another one of my classmates from Pittsburgh was in Zuni, Dave Sharp. So I had all these connections all around the reservation where there were Jewish connections as well as medical connections. It was really nice.
We found that, Noel and I found that we opened up this whole box of opportunities for further research in choosing this as a topic. When I interviewed Joel Rosen, who was in Cayenta, of the 11 physicians in Cayenta, 5 of them were Jewish. So when you hear that, you want to just go, oh, I can't believe what you're telling me. And he's in contact with several of them still after all these years. So yeah, this is a book, right? Really more than just than an interview itself. So yeah, really quite a thing. Tell me a little bit more about the clash between traditionalism and academic training that you.
You mean Native American traditionalism?
Yeah.
Well, I mean, it was a big deal to get them to take medication, really a big deal, because again, it was nothing they did traditionally in terms of white man's medicine, so to speak, because they had their own cures, different roots, different medications that were based on natural ingredients. And generally, well, many of them were very sick when they came. So they were more willing to undergo treatment because they clearly were in a lot of trouble. As they got better, they were less and less inclined to take our medication. So it became a bit of a problem. But as long as we worked with the medicine men, and we did agree to allow that relationship to flourish between ourselves and the more traditionalists, we had less and less problems. But there were some issues because some of the patients did get worse on the medication. They had reactions. And so that was a step backwards at times. I remember one fellow, a wonderful guy, who was a sheep herder from the near, I think the from Sheep Springs, which is right near Gallup. Barney Begay, I'll never forget him, the most wonderful guy, about 80 years old, big guy, but he would never respond. Now, like I said, they don't talk much. We always had to drag things out of him, and we couldn't figure out, he just was getting less and less responsive. And we used to run all these tests to make sure they weren't getting any of the side effects of the drugs, because many of the drugs we used had a lot of side effects because many of the Navajos had been partially treated before, and they developed what's called drug resistance. So we had to use other of the original 3 drugs I mentioned, streptomycin, INH, and rifampin. There were 9 other drugs, things like kanamycin, and kanamycin has this terrible side effect of deafness. And unfortunately, Barney had developed drug resistance, and so he was being treated with kanamycin. And the reason he wasn't responding is that he was going deaf. And we didn't even realize it because he hadn't gone in for his test. We used to give them hearing tests every month to make sure they were all right, but somehow he had been missed. And so there were some issues because of these terrible side effects we had to be careful about. There was one called PZA, which caused patients to get gout. So there were always issues because we were treating people who, many of the Indians who had had serious drug resistance. And in fact, we treated more cases of drug-resistant tuberculosis than any other hospital in the country, other than National Jewish Hospital in Denver, which is a pulmonary hospital, as you know. So we had a unique experience there, and we had some unique problems as a result. But most of them we were able to resolve. And the other thing that was very helpful, the other part of the equation that made it more possible, is that we had wonderful translators who worked with us and staff. All the staff were also Native American. It was a little bit of a problem in that most of the staff, most of the nurses were Pueblo, and most of the patients were Navajo. And the Pueblo and the Navajo did not necessarily get along all the time, but mostly they did. So we had the good fortune of having staff who were also connected to the patients. And that helped smooth things over and provided a good integration there. And communication between us and the patients through our staff. So that was very helpful.
Michael, you've answered very thoroughly and very nicely all of my questions except for one, which is why did you decide to stay in New Mexico?
How could I not? It is the most beautiful place on earth, as far as I'm concerned. I've seen a lot of the earth. I've lectured now in 20 different countries. I've had the good fortune to see so much of the world, but there's nothing like New Mexico. The light, the color, the people, the vistas. It's not replaceable anywhere else. I miss it dearly. But I miss you a lot too. But I'll tell you, blood is thicker than water, as you know. And
we need a lot more water, I'll tell you.
Yeah, I know. We can share. We've got plenty of that. But we also have our 4 grandchildren right across the street now.
Right.
What a machaya. What a blessing. Yeah, really.
Well, that should do it. And I want to thank you so much for
Yes, and
you and for the pleasure of learning all of these new things that I really didn't even know about you. And if you think of anything else, just send me an email and we'll include it in the interview and some kind of or something like that.
I sure will, Harvey. You're one of my favorite people. You always have been. You're such a mensch. You do so many things so well for the synagogue, for the community, for our people. It's really been a great pleasure and a privilege to know you and count you as a friend.
Thank you very much. And give our regards to Minnie Joe and girls and everybody. God's a mishpacha.
Thank you. You too.
Well,
yeah, let me also chime in and thank you, Mike, very much for taking the time to join us with this conversation. It was absolutely fascinating. I'm an anthropologist, archaeologist by training and studied at UNM in the early 70s for my master's, and learn more about Southwest and some of the particulars of Navajo tradition than I was aware of previously. And we will edit this recording, and before we post it on the YouTube site, we have a New Mexico Jewish Historical Society YouTube site. We will let both of you have a sneak preview before we go live with it, certainly. But again, thank you so much to both of you for giving us this wonderful opportunity. So enjoy and take care of yourselves.